heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. What's the difference? So heart failure with reduced ejection fraction is exactly what it's stating. The ejection fraction, which is the amount of blood that the heart pumps out each pump, is normally between 55 and 70%. So with reduced ejection fraction, that could be between 40 and 50% or even below. So this is another name for systolic heart failure, where during the active phase of the heart, it's not working properly. The left ventricle cannot pump adequately enough to eject enough blood to flow through the body. With heart failure and preserved ejection fraction, the ejection fraction really isn't any different. It doesn't affect that, but the left ventricle can't relax properly. So it can't fully fill. It still manages to pump enough blood out, but it's not able to relax during that diastolic phase. So this is another name for diastolic heart failure. So in both of these types of heart failure, the left ventricle just isn't working properly. So the heart is going to become fatigued a lot more quickly. The blood is not going to adequately be pumped throughout the body, so the oxygen uptake is not going to be great, and the patients are going to have decreased exercise tolerance. So intensity-wise, you do want to still give your patients the as high intensity exercise as they can possibly tolerate, because that is going to benefit them. That is going to increase their VO2 max and their VO2 peak. That is going to increase their oxygen uptake of their muscles and help them to perform exercise. It's just, trying to figure out how much they can tolerate. So it's a little bit of a catch-22. But it's definitely worth knowing where your patients are and what type of heart failure they have. That way you can adequately prescribe the exercise and monitor them and make sure that they're responding well to it. Another interesting tidbit about systolic and diastolic heart failure is that systolic heart failure actually affects more men who live in rural areas, and diastolic heart failure affects more older women who live in urban areas. Who knew? So for more information about heart failure, follow our seminars here and check out our Update Your Care Plan series on heart failure.